Dear students, welcome back. In the previous session, we have seen the stability of the radioulnar joints. Now we are going to see the mobility and stability of the elbow complex. Okay, so the functional activities at the elbow complex, which mainly involves the joints of the elbow complex, that is the elbow joint and the proximal radioulnar joint and the distal radioulnar joint. That means the joints and muscles of elbow complex are used in almost all activities of daily living, such as dressing, eating, drinking, carrying and lifting. And they are also used in tasks such as splitting firewood, hammering nails, and in sports such as tennis, golf, basketball and baseball. Most of the activities of the daily living require both the combination of motion at both the elbow as well as the radioulnar joints. Okay, so the combination of the movements of this elbow complex is very much required for our daily activities. Okay, so some studies have been done how much range of motion is required in elbow flexion as well as supination and pronation in various daily activities. So Morey and associates measured elbow and the forearm motions in 33 healthy subjects during 15 activities, and the authors concluded that a total arc of about 100 degrees of elbow flexion, that is between 30 and 130 degrees, and about 100 degrees of forearm rotation, that is 50 degrees supination and 50 degrees pronation, is sufficient to accomplish simple tasks such as eating, drinking, brushing hair, brushing teeth and dressing, like that. So for all our daily activities, if you have enough 100 degrees of elbow flexion, that is within the range of 30 degrees of flexion to 130 degrees of flexion, in between that 100 degrees of elbow flexion is enough for our daily activities. Whereas the pronation is about 100 degrees, that is 50 degrees of supination and 50 degrees of pronation is enough for our daily activities. Okay, so they have studied in different activities, and in those activities we can see how much degree of flexion and pronation and supination is required. So if you see all the ranges, these ranges will fall in between the 100 degrees of elbow flexion as well as the 50 degrees of supination and 50 degrees of pronation, which is not beyond this thing for our daily activities. So now we are going to see some of the studies they have done in different activities in this table. Here you can see the different activities, that is combing hair, wash, axilla, use telephone, rise from chair, open door, read newspaper, pour from a picture, put glass to mouth, drink from cup, cut with knife, eat with fork, eat with spoon. Like the so many activities are there, and we can see how much flexion, elbow flexion is required and how much pronation and supination is required for our daily activities. For example, if you can see this use of telephone. So this for use of telephone, 40 degrees of pronation and 20 degrees of supination is enough. If you can see here, so 40 degrees of pronation and 20 degrees of supination is enough to handle your telephone. And how much flexion? So this flexion again falls from 42 to 135, that is, which is in between 30 to 130 degrees of flexion, isn't it? This is the range, minimum and maximum. So the total arc is 92.8. So this falls only around 92 degrees of elbow flexion in between the range. Okay. Now, and also we can see the mobility of the complex in different activities. If you can take any one of the action, using the telephone requires largest arc of motion in flexion, that is 92.8 degrees, and pronation and supination, the arc, if you can see, is 63.5. If you can see any activities, this falls with maximum arc here, and also the maximum arc also falls with eat with fork here. So some 97 degrees here it is falling. And cutting with the knife requires the smallest arc of flexion and pronation and supination. Here cutting with knife, here in the cutting with knife you can fall only 15 degrees of pronation and supination. If you see the flexion also, so the arc is 17.5 degree arc is present. So and the range is also in between 30 to 130 degrees. So minimum is 89.2 and the maximum is 106.7, that is in between the arc is 17.5. So this is the least thing is required for cutting with a knife. Okay, and if you can see in this pic, so that is drink from cup. So this one we can see this drink from cup in this picture. Yes, here. So this is the picture. You can see the drinking from the cup. So some here in this table also the ranges are given here. So that person is according to Sephirat in the previous table. Drinking from a cup requires a range of elbow flexion. This is the elbow flexion. A range of elbow flexion is in between 72 degrees and 129 degrees. And a range of pronation and supination is between 3 degrees to 3 degrees and 31 degrees. Here the supination and pronation. So this one is pronation and this one is supination. The range is in between 3 degrees and 31 degrees for drinking from a cup activity. How much elbow flexion? It is in between 72 and 129 degrees range, and pronation and supination range is between 3 degrees and 31 degrees. Okay, so these are the ranges of flexion and supination and pronation is required for our daily activities. Now if you can see the relationship of this elbow complex with that of the with the hand. So this is the hand and the wrist. This is the wrist and this one is the hand. Okay, how this elbow complex is related to the hand and the wrist. So the design of the radio ulnar joints enhances the mobility of the hand. So the design which increases the mobility of the hand. In primitive mammalian species, the ulna was a major weight-bearing structure and was connected directly to the carpels through a dense immobile syndesmosis. The complete separation of ulna from the carpels by the articular disc and the formation of a true diarthrodial joint lined with articular cartilage are the features that permit supination. So this is supination and pronation. Supination and pronation. Okay. So this is an evolutionary change. So for such a kind of design permits the pronation and supination to occur in every position of the hand to the forearm. Okay. Pronation and the supination of the forearm when the elbow is flexed at 90 degrees, rotates the hand so that the palm faces either superiorly or inferiorly. That means, so at 90 degrees of flexion, the palm can face superiorly as well as the palm can face inferiorly. Okay, the mobility afforded the hand is achieved at the expense of stability. So this mobility of the hand is achieved mainly by the stability of the other structures. Okay. The movable forearm is unable to provide a stable base for the attachment of the wrist and hand muscles. Therefore, many of the muscles, so the movable forearm is unable to provide a stable base for the attachment of the wrist and hand muscles. Therefore, many other muscles that act on wrist and hand are attached on the distal end of the humerus rather than on the forearm. That means the muscles which are originating from the humerus, so whether it may be a medial epicondyle or it may be lateral epicondyle, these muscles will give stability at the wrist joint. Okay, during the movable forearm. So these muscles will have least function at the elbow joint and the radioulnar joints. Okay. Next, the location of the hand and wrist muscles at the elbow and the fact that these muscles cross the elbow create close structural and functional relationship between the wrist and the hand complexes. Okay, so that is the thing I have explained here. And anatomically, the hand and wrist muscles reinforces the elbow joint. So the muscles which are crossing the joint which give stability at the elbow joint or as well as the radioulnar joint. That means it reinforces the elbow complex. Okay, some studies like in cadaveric specimens, Davidson and co-workers found that the humeral head of the flexor carpi ulnaris muscle. So the flexor carpi ulnaris muscle. So this is the flexor carpi ulnaris muscle. Is the only muscle that lies directly over the anterior portion of the medial collateral ligament. This is the only muscle which is directed anteriorly over the medial collateral ligament at the elbow flexion positions from 90 degrees to 120 degrees. So because the medial elbow is subjected to the largest valgus stress during the cocking and acceleration phases of throwing, which occurs between 80 degrees and 120 degrees of elbow flexion. So the flexor carpi ulnaris muscle has the potential to provide significant reinforcement for the medial collateral ligament during all throwing activities. So this muscle is giving a reinforcement to the medial collateral ligament also. Okay, and some other studies by Lin and colleagues suggested that the flexor carpi ulnaris and also flexor digitorum sublimis and flexor carpi radialis function as dynamic stabilizers. So what are the muscles? Flexor carpi ulnaris and flexor digitorum sublimis and the flexor carpi radialis functions as dynamic stabilizers, with the flexor carpi ulnaris being the primary stabilizer for elbow valgus stability. So although the three muscles, what are those three muscles? Flexor carpi ulnaris, carpi radialis and also flexor digitorum sublimis, all these three muscles acts as the dynamic stabilizers. Out of these three muscles, the flexor carpi ulnaris is the primary stabilizer for elbow valgus stability. And also the flexor carpi ulnaris, these three will have another function. These three muscles will significantly reduce the medial collateral ligament strain at 45 and 90 degrees. And all extensor muscles, are going to increase the strain in the medial collateral ligament. Okay, so the medial collateral ligament in some way is protected by these flexor muscles, and the strain for this medial collateral ligament is increased by extensor muscles, okay, which are crossing the elbow complex. So this is the thing happening during mobility and stability of the elbow complex. And we can also consider some relationship to the head, neck and the shoulder. How this elbow joint is related to the head, neck and the shoulder. Okay, head and neck positions have been found to affect the elbow flexor torque production in healthy young adults. It can be seen only in healthy young adults. Clinically, it has been observed that restrictions of motion in the neck and shoulder, neck, only neck and shoulder also affect the function of the elbow. Limitation of the shoulder joint. So in the shoulder joint, if there is a limitation to the internal rotation, may cause a subject to excessively pronate. So if shoulder joint has limited internal rotation at the elbow joint, which shows excessive pronation to compensate the lack of internal rotation at the shoulder joint. And so normally it is occurring during throwing or racket swinging activities. So during throwing and racket swinging activities, so to compensate this internal rotation of the shoulder joint, the forearm is going to pronate more than normal. Okay, excessive supination of the forearm may be used to compensate the lack of external rotation at the shoulder. So these are the things happened, and these happened if anything is any change in the range of motions in the above structures, that is the shoulder, head and neck. So also affects the elbow complex motions. So head is related to neck. So any change in the head which causes some restriction in the neck, and with this neck causes some changes in the shoulder joint, and from the shoulder joint the changes are occurring in the elbow and the elbow complex. So these are the things you have to understand in the stability and mobility of the elbow complex. In the next session, we are going to see effects of age, gender, and injury, and also the immobilization. What are the things, or what are the variations happen to the uh, elbow complex structures, how, what are the changes occurring to the normal structures and the normal range of motion and also normal functional activities. Okay, all those things we can see in the next session. Thank you.